Hello, my name is Amanda Barlow. I am a registered nurse. I was born in Beaumont, Texas in 1978. I was born as the second child to Lloyd and Karen Musgrove. Unfortunately, they both passed away when I was at the age of 8. I was raised by my paternal grandparents. I have been married for 20 beautiful years and I have 2 young sons. I graduated from Vidor High School in 1997. I graduated from LVN school from Sewella Technical Community College in Lake Charles, Louisiana in 2006. I went right on to pursue my registered nurse, and I attended Lamar State College in Orange for my Associates of Applied Science degree, which I graduated in 2009. I started working at DeQuincy Memorial Hospital as an LVN in 2007, just on the med-surg floor as a staff nurse. I remained there till 2010. In 2010, I went to work for Southeast Texas Hospice as a staff RN, and I am presently there. In 2017, I decided that I wanted to continue my education. I enrolled in the RN to BSN program at Lamar University. I am also a member of the National Student Nurses Association. The Baccalaureate of Science in Nursing program of Lamar University has afforded me with opportunities to improve and strengthen my nursing skills in preparation for the next phase of my nursing career. The past 9 years I have worked in the home health and hospice fields. This has given me much satisfaction to be able to help patients in their homes and at the end of their lives. However, my desire is to help patients in an even greater capacity, so I have spent the past 2 years in the baccalaureate program preparing for an advanced career in nursing. At the completion of this program, a graduate student is expected to become a competent, caring nurse in the following constructs. Number 1, humanity and society. Number 2, lifespan health continuum. Number 3, evidence-based practice and clinical reasoning. Number 4, patient-client-centered care. And number 5, professional roles. These 7 student learning outcomes are greater indicators of the information learning through this program. The first student learning outcome of the baccalaureate program is that the student will practice safe and effective holistic patient-centered care to a variety of patient clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. In Nursing 4316, the Comprehensive Holistic Health Assessment gave me opportunities to practice head-to-toe assessments. Along with health histories, Madeline Linginger's development of cultural care theory and ethno-nursing were informative and inspirational to me. In Nursing 4321, Nursing Theories, through the Windshield Survey and Nursing 4540, Practice, Care of Communities, I learned how important it is to look at the bigger picture of a patient's life, including their environment and available health resource. The outcome was met at 90%. The second student learning outcome of the Baccalaureate of Science in Nursing program is that the students will support patients' clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. Health includes all of these aspects, not just how one feels today. When ill, a patient's goal is to restore their health. When well, a patient's goal is to maintain their health. Just as important as the prevention of disease, and at the end of life, a patient's goal is to die with dignity. Throughout a person's lifespan, these 4 comprehensive patient goals need to be supported by the medical professionals who serve the patient client. In my previous experience as a hospice nurse, I have served many dying individuals and was already aware of how important it is to provide a patient with dignity as they face their death. But in Nursing 4316, Comprehensive Holistic Health Assessment, the importance of supporting patients' clients during the prevention of disease and restoring of health times of their life became clearer to me. Patients' clients need to receive good medical care throughout their whole lifespan, not just at the end. While developing the Personal Disaster Plan leaflet for Nursing 4540, Practice, Care of Communities, I became aware of how important it is for a patient client to have available their medical information during emergency situations. The outcome was met at 95%. The third student learning outcome is that the student will be able to evaluate patient-centered care for patients' clients across the lifespan based on common and complex health needs and compromised health states when considering multiple determinants of health. In Nursing 4316, Comprehensive Health Assessment Lab, I learned what to look at and what to assess in a patient's condition. Nursing 4620, Care of Cardiac, Renal, and Pulmonary Compromised Health States assignment, provided opportunities to hear and compare heartbeats of all ages and races of patients as well as lung sounds. I feel that these opportunities for audio learning increased my confidence as a nurse in performing patient assessments, and the outcome was met at 97%. The ability to synthesize clinical and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice is the fourth student learning outcome. Nursing 4580, Practical Synthesis of Professional Nurse, provided opportunities to practice professional, organizational, and personal perspective within ethical and legal frameworks. The outcome met is yet to be determined. The fifth student learning outcome is that the student employs safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients and clients and members of the interprofessional and intraprofessional healthcare team. In Nursing 4580, Practical Synthesis of a Professional Nurse, we became aware of what can occur when a medical team fails to collaborate with each other. Discussion 1 in this class was a great example of failure to collaborate. An advanced practice nurse should contribute to the collaborative education systems in which they are employed. As part of my 5-year plan, includes employment as a director of clinical services in the hospital setting, it will be important that I have gained collaborative experience. The outcome met was 100%. Next, the student should have the ability to differentiate multiple role dimensions and practices within ethical, legal, and regulatory parameters. When care for patients, clients as a member of the interprofessional and intraprofessional healthcare team. The learning outcome was addressed in Nursing 4391, Evidence-Based Practice and Inquiry. Ethical principles can be violated in healthcare, and it is paramount that medical professionals be aware of these nursing ethics and know what actions to take when these ethics are infringed. Nursing 4550, Practice, Leadership, Management, and Healthcare show that it is incumbent upon the advanced practice nurse to be able to effectively use current educational technology. Nurses are liable for their actions, so they need to be able to utilize all available resources. The practical assignment clinical application afforded me with the opportunity to work with others to develop a policy and plan in place to make the administration of medication safer for a patient. The outcome was met at 86%. The seventh and last student learning outcome is that the student should demonstrate professional integrity, effective communication, active inquiry, and service to the community. Nursing 4540, Practice Care of Communities, afforded the opportunity to research medical needs before, during, and after a natural disaster, and create a personal disaster impact plan brochure. This experience strengthened my resolve to serve as an advocate for patients and clients, as well as my commitment to help provide health resources and services to all persons. The outcome was met at 96%. As a practicing RN with 9 years in the home health and hospice fields, I am ready to take the next steps in my career. Adding the BSN to my portfolio will increase my value to potential employers and will provide me with the opportunity to make my own choices about the scope of my nursing career. It is my 5-year plan to obtain a Baccalaureate of Science in Nursing in 2019. Then pursue a specialized certification in hospice and palliative care nursing at Purdue University. Once I have obtained the certification in 2021, I plan to obtain employment as a hospice director of patient services. I hope to work in this capacity for a couple of years and then pursue employment as a hospice director of clinical services. I would like to thank the professors, support staff, and students of Lamar University's Joanne Gay Dishman School of Nursing, Baccalaureate of Science in Nursing program for all of their support. Thank you.